so that we have that for parts that folks miss, or if people can't join us. I will share all the slides from today and also the recording to everyone after the meeting. So I wanted to just take a minute to go through who we have on the call. I believe from Ohio, Dr. Zimnick also is a maybe for today. So from Ohio AAP, we have myself and Liz Dawson, I believe. From Prevent Blindness Ohio and National, I believe we have David and Amy. Is there anyone else from PBO on the line? And I know Kira was unable to join us. And then from ODH today, we have Cindy and Molly. Oh, and I think Dr. Zimnick also just logged on. All right, so we will go ahead and get started with our monthly meeting. As usual, I want to go through kind of updates on the practices and their status. We've had at least another training this month, and then we had a second one scheduled. Well, actually, we completed 3, I think, this month. And then we had a 4th scheduled, but unfortunately had to reschedule that one. I was hoping we would be all done. Sadly, we are not. I wanted to give you some updates on data that we have received from some practices and just kind of our status with each practice on data and my plans for addressing some challenges that practices are having, and then next steps. Did anyone have any other items they wanted to add to the agenda for today? All right, if not, I will start with our summary of our active practices. We have I think we have 1, 2, 3, 4, 8 on this sheet and then 3 on a second sheet. So one of the practices on this sheet did complete their training this month. That was Fairfield Medical Associates. We completed that training on May 11th. So they are all up to date. I believe we certified 3 folks there. David, I am going to kind of go through all the sign-in sheets and just update for all the practices on our spreadsheet who actually did attend and was certified, and I'll update all of these numbers. There may be a few sign-in sheets that I'm missing, so I'll email you for those if I don't have them, if that's okay. And then, oh, go ahead, David, were you going to say something? Okay. And
nope,
then,
I'll be sure to get those to you. Thanks.
Okay, thank you. And then for data, so COPC, Primary Care Physicians East, was supposed to have their data to me yesterday, and I did not get that. So I did reach out to Brittany this morning to check on that. They had actually sent some data along a while back, but it was not the data that we wanted. It was actually sort of more a few individual patients that they were referencing. So I reminded her with the spreadsheet that we have. And so I corresponded with her last week, and she was supposed to have it to me yesterday, but it didn't come. So I'm checking with her. Rainbow Pediatrics Euclid are having some significant challenges. They have had staffing issues and are not feeling like they're going to be able to begin the work until the fall. So I'm actually scheduling a call with Dr. Gundar there to just check in and see what we can do, because obviously we wouldn't be able to give them MOC 4 credit and all of that. So I want to see if there's anything we can do to help them kind of complete the project as we had planned and get a little bit better idea. I think when we've had the training with them and in my subsequent calls, things seem to be okay there. I actually felt their training was one of the best ones that we had, and they seem to be really on top of things. So I was really a little taken aback to kind of get that message from her. So I will keep folks posted on that. Peds on Wheels, we do have some data from them that I'll share. Same with Dayton Children's. I'll go into a little bit of some of the challenges that they've had. So, and ask kind of if folks have an opinion. I have some suggestions in terms of baseline data. Dayton Children's is not able to access 2021 data, and that's what we were wanting to use for baseline. So they have another proposal, and I want to see if folks feel that that's okay. Similar to Rainbow Pediatrics, Chardon has had some significant challenges recently. We trained them early in April, and just to let you see an email that I received just yesterday from Dr. Parisa there, but they've had a lot of turmoil lately and they're having resistance from their staff. Again, I didn't pick up on a lot of that at the training. David, I don't know if you felt that way, but it didn't seem that folks were like negative toward the new process. They're also having a doctor retiring, and Dr. Parisa is mentioning that he may also be leaving the practice. So I'm also scheduling a call with him to just check in and see if there's anything we can do in the meantime, again, to get kind of what we need to get completed for the project. Primary One Health, again, we trained them at the end of April, so they are working on pulling their baseline data and planning to get that first month of intervention data to me in early June, because May is really their first month of intervention. Similar with Fairfield, since we did their training just on May 11th. Any questions just over the sort of summary of these practices? All right, and I'll move to our last three. These are the newer practices that signed up a little bit later in the process. We did complete 2 of the trainings with Beaver Creek and Inglewood in early May. The Kettering site was scheduled for May 19th, but unfortunately had some vacations and staff out, and with schedules, the earliest we could get that one scheduled is June 7th. David, I was going to check in with you too soon, just kind of on their module completion status, just to see if I need to do a bit of nudging. I just included some of the recruitment priority data on the side here for them, since they are a newer practice. They are currently only screening 4-year-olds. I would say that these were the practices I sort of felt the most resistant to the process, and not from the providers or the administration, but more from the MAs and nursing staff. So at the 2 practices that we've been to so far, they actually are on paper charts, so they do not have an EHR. And I've been working with their lead provider on their kind of clinic process for tracking the screenings and then reporting the data to us. Any questions on Pediatric Associates of Dayton? All right, if not, I'll share with you some of the data that we currently have. So Dayton Children's, we have both of their sites. The Dayton Children's, I'll just say the sort of general site, and then the Hope Center. So again, just keep in mind that their training was completed February 21st of 2022. They have been unable to access 2021 data for baseline. We were actually wanting them to pull baseline data from the previous months in 2021 to use. So one of the kind of workarounds that I thought is just if we use January and February 2021 data. I'm sorry, that should be 2022 data, since they have access to that for baseline. And remember that their baseline screenings would have all been with Snellen charts for age 3 to 5. And in the data that they did submit for March and April, they did not provide details on patients who did not complete a screening. So that's one of the items I'm going to follow up with them on when I have their follow-up call. Each of the practices that have submitted data, I'm going to have a follow-up call with them to talk about their data and sort of some questions and suggestions that we may have. So if you look at the chart, for each clinic, we'll start with a % of patients who completed a vision screen. At the bottom is the month. And then I have the numerator and denominator. So in March, they had 73 age 3 to 5 patients who had a well visit. 29 of those completed a vision screen. There was a dip in April. I'm not sure what that's attributed to. That's one of my questions for them. They had 94 patients, 39 received a vision screening. Any questions about that before I move to the next chart? All right, this is the percent of patients with a passed vision screen. So as you can see in March, 23 of the 39 passed the vision screen, and 37 of 39 passed the vision screen in April. Questions there before I move on? These are patients with a failed vision screen. So in March, there were 0 that they reported that failed, and then 2 that failed the vision screen in April. So just some notes that I made for myself that I kind of have to think through, or I was a little confused as I was looking at it. So in March, they had a total of 39, 23 passed, 0 failed. So I wasn't sure about that 16, like what was the status for those patients? So that again is a question I want to follow up with them on.
Kristen, there are probably ones that were incomplete.
That's kind of what I wondered. That makes sense. So, and then for patients who were referred to vision specialty care, and again, I think this can highlight a question, or again, to check in with them. In March, they did know that there was one patient that was referred. So this kind of didn't work out right on the chart, but they had one patient that was referred in March, but as I said, they reported that 0 failed. So I kind of want to check in on that. And then both of the patients that failed the vision or did not pass the vision screen in April were referred for specialty care. These are the percent of patients with the 99173 coding. As you can see, in March, they did not code that for any patients. In April, 9 of the 39 were coded using the 99173. So again, I have a question on why that isn't being used more. Why are they only doing it for so few patients? I'm not sure the answer to that, but I thought that was a little peculiar. All right, and then staying with Dayton Children's, this is the Hope Center. Again, same training date. They do have the same staff that rotate, I believe, to both of these sites. The numbers for the Hope Center are much smaller than their, what I'll just call their main site. But again, some of the same questions that I had for the initial Dayton Children's site. So again, for the month of March, they had 13 of 26 patients who completed the screen and 12 of 30 who completed it in April. So they saw the same dip, which again, I thought was interesting at a different site, but what that's attributed to, I'm not sure. Similarly, in the Hope Center site in March, there was 2 of 13 that passed the screening, again, which I thought was really interesting, and 9 in April, 9 of 12 who passed the screening. They reported that there were 5 patients that failed the screening or did not pass the screening in March, and then 3 who did not pass the screening in April. And again, that same question of 13 screenings in March, 2 passed, 5 failed. Were the other 6 incompletes, or what the status was there? 3 of the 5 who did not pass were referred in March, and 3 of the 3 who did not pass were referred in April. And then again, the 99173, seeing very few being coded with that code. So I'm going to follow up with those questions for Dayton Children's. So any comments or questions about them before I move on to Peds on Wheels? All right, so as a reminder, their site training was March 9th of 2022. The site has provided March and April data, just keeping in mind that most of March they were not using the new equipment, and they have not provided their baseline data. So but again, reminding you that for all of their baseline, they would have been using Snellen charts. Dr. Johnson has been on active duty, and I'm going to have a follow-up call with him. He's supposed to be back not on active duty early this week. So I'm going to have a follow-up call with him to go through their data and see what we can do again about getting baseline data. And they also did not provide detail on patients who did not complete a screening, which, we have on the spreadsheet, and we ideally would really like to have that. So again, to give you some idea for them, there were 26 patients in March, 11 had a vision screen, 8 of 24 had a vision screen in April. Another dip from March to April. So I just don't know what that's about. For both months, they had everyone that they screened passed the screening, so there were no fails. And then every patient was also coded with the 99173 code in March and April. So I will stop there. That's all of the data that we currently have. And again, mention to you that I will be having follow-up calls with all of the practices who have submitted data, and then those ones that I mentioned who are struggling for whatever reason with submitting their data. And then we will be completing the final training in early June with the final date and practice, and working with those practices that have had later trainings again to get their data submitted as soon as possible. So any questions or comments? I'll kind of stop there.
Can you go back a slide?
Yes.
Okay, one more back.
One more back.
Yeah. One more. Here we go. So so when these are the completed out of total. And then go forward again, then. Percent of patients with past vision. So those are of all of those that are completed.
Correct. So they only completed 8 of 24. So of the 8 that they did, 8 of those passed. Does that make sense?
Yeah, it does. I guess I don't know if it gives you much. You're not going to have very many that fail. So I'm not sure if charting that is going to be real beneficial.
Yeah. You mean because of that low number?
Yeah.
Yeah.
So
my real thing I'm interested in is
this one.
Right. Exactly. I mean,
So
this
we want 100% completion.
Right.
And then we want 100% of those that failed to be referred.
That's the meat of this. So my question for them is like, why were there only 8 of 24 that were screened? And is it an age issue? Is it like what got in the way? Because that's a very low number.
There are only 8 screened. Well, what they're saying here is that 8 had a completed vision screening.
Mm-hmm.
Question, you don't know if the other ones were still screened but incomplete, or if they weren't screened at all.
Exactly, if they weren't even attempted.
So what we probably want to graph then is this chart needs to be percent of patients with an attempted vision screen. And then the next chart, instead of the ones passed, the percentage of the patients with a successfully completed vision screen. Mm-hmm. It may give you better visual data of what you're looking for.
Right. Got it. Yeah, so anecdotally, so I can update the spreadsheet to note that for the next submission. Okay. And then I can kind of try to dig in a little bit to this, the remainder of whatever 24 minus 8 is, and just try to get an understanding of what happened with those patients. Were they attempted, but they couldn't get them to complete it? And then I also want to know, now that practices are doing these, for the practices that are doing them, I mean, David talks about this in the training, like what is going to be their process or approach when they attempt a screening and the child is not able to complete it? Are they bringing them back in? Are they referring them? I kind of want to know that for each practice, what they've decided that process is going to be. Any additional questions or comments that folks have? things you would like me to follow up with based on what we've talked about today with the practices when I have my follow-up calls? And I know we did have one practice, Dr. Zimnick, that you're following up on a question that they had. It's escaping my memory right now, but it was a coding question just in terms of, I think, again, they're wanting to do their data reporting from their EHR. And so I think in terms of coding passed and failed vision screens, they were just asking how to do that with Z codes or something like that. I think that was primary one that had asked that question. Oh, no, that's okay. I let them know that you were working on getting an answer back to them, and that we'd let them know.
So.
All right, thank you. Thank you for checking on that. All right, any other questions or comments? All right, I will send out, like I said, the slides to everyone and the recording. And if you have any follow-up questions, please let me know, or any other items that you would like me to explore when I have my phone call with the practices, follow-up phone call on data coming up. All right, thanks so much, everybody.
Thank you.